This is Mark Gunn Media.
Hit it!
Welcome to Gunshots Straight from the Hip. I'm your host, Mark Gunn. The views expressed on this program are those of the host and guests and not necessarily reflective of anyone or any entity associated with this broadcast. This episode, COVID-19, where we are now, and what do we do for the holidays? In this episode, you're going to get an update as to where we stand with the coronavirus, and we'll also hear from some frontline doctors, nurses, and paramedics as they talk about an aspect of COVID-19 that's becoming as big a problem as the virus itself. Here's where we currently stand.
Cases, hospitalizations, and deaths are on the rise in the U.S. as the country continues to suffer from the coronavirus pandemic. It's getting much, much worse. The U.S. added over 159,000 coronavirus cases, bringing the overall total to 11.4 million cases. Hospitals continue to run out of space and equipment as more than 73,000 people were hospitalized as of Monday, an increase of over 3,000 from the day before. The average U.S. deaths per day has also now reached over 1,100, up from just under 830 2 weeks ago. The average pace is expected to climb in the coming days. It is getting so much worse.
It is, and the White House knows it. NBC News has obtained a copy of the White House Coronavirus Task Force latest weekly report to states that delivers an assessment of the pandemic's trajectory. The report dated November 15th is jarring. It reads in part, there is now aggressive, unrelenting, expanding broad community spread across the country, reaching most counties without evidence of improvement, but rather further deterioration. Current mitigation efforts are inadequate and must be increased to flatten the curve to sustain the health system for both COVID and non-COVID emergencies. Heading into Thanksgiving, the report warns the upcoming holidays can amplify transmission considerably. States should continue to expand public health messaging across all media platforms, including SMS auto texting, to warn citizens about the risks of social gatherings, advise people to avoid them, and re-emphasize face coverings and social distancing. Specifically, recommend holding an event only with individuals within one's household and emphasize the risk of exposing an elderly person or someone with an underlying condition if gathering indoors without masks. Again, that's the White House Coronavirus Task Force weekly report. Let's bring in President of the American Medical Association, Dr. Susan Bailey, and Chief Nursing Officer for the American Nurses Association, Debbie Hatmaker. Dr. Bailey, the White House assessment there is pretty stark. It tells the story. What's your assessment of where we are right now?
Things are indeed very grim. Doctors are concerned that our hospitals are filling up and that we really need to double down on our basic preventive measures, wearing masks, washing hands, keeping 6 feet apart, and avoiding large indoor gatherings. We have some vaccines and exciting things coming around the bend, but we want to be ready for them when they get here. And so we need to work as hard as we possibly can right now to slow down the number of new cases.
Debbie, we've seen nurses doing interviews, trying to get the word out to show what it really looks like in these ICUs, what it looks like in a COVID unit, many of them being overrun across the country. What can you tell us about what your nurses are seeing there on the front lines?
We are hearing that things are quite stark, and we're very concerned that this delay in the transition is negatively impacting that. Just this week in North Dakota, we heard that some facilities are running critically low on supplies, and that nurses are being asked to transition and work in other units for which there hasn't been time for orientation and for adequate preparation or training for that. So we're concerned about that, and the delay in the transition only impacts that. So it is time for the Trump administration to begin to prepare the Biden transition team on those important issues around the stockpile for the necessary critical medical equipment. We're still seeing delays in PPE, inadequate supplies on PPE, and this will only get worse with the delays in the transition.
Now, one of the unintended consequences of not getting this virus under control is the help that Americans have been getting from Congress. So far, the talks between House Speaker Nancy Pelosi and Majority Leader Mitch McConnell have stalled. In fact, they haven't really talked since October. Now, if they don't get their collective stuff together, expiring at the end of the year will be emergency unemployment relief, the eviction moratorium, 2020 rebate checks, student loan forbearance, small business debt relief, the paid sick leave tax credit, payroll tax deferral, and 33 other tax provisions. So as the Trump administration continues their stonewalling and preventing the transition to the Biden administration from taking place, more and more Americans are dying. As cases get worse, and as we approach the holiday season, more governors and mayors are faced with the decision on whether or not to impose stricter measures. A total shutdown. On the flip side, and you've seen this for yourselves, lots of businesses have made the investment to make their workplaces safer for customers. Thanksgiving's going to be a whole lot different for a lot of folks this year because people often travel during the holidays. The Center for Disease Control is recommending limiting your gatherings to those that live in your immediate household or hosting an outdoor event if possible, all while wearing masks, social distancing, and taking all of the other recommended precautions.
So several colleges and universities are exploring different strategies on how to handle Thanksgiving break amid an uptick in cases nationwide. The University of South Carolina, Syracuse University, and Emory University are among those planning to end in-person instruction ahead of the holiday. The University of Missouri has told students to stay home until January amid a recent rise of cases in the state. On the other hand, some schools are advising students not to leave. Boston University is asking students to remain on campus and host Friendsgivings. The State University of New York system said its 140,000 students must test negative if they want to leave campus. And Penn State University is encouraging students to get tested before leaving campus and to finish their studying online. These Thanksgiving strategies come as a researcher from Ball State University found that thousands of students on spring break trips were responsible for community outbreaks earlier in the year. The governor of Connecticut, Democrat Ned Lamont, he is currently self-isolating after one of his staffers tested positive for the coronavirus. Governor, hope your staffer is doing okay. What is your warning to students in Connecticut coming home for Thanksgiving?
We got together with all the governors from Pennsylvania up through Massachusetts, and we've all issued a directive. If you want to come back to your home state from wherever you're going to college, say in South Dakota or North Dakota, you must get tested before you leave. We'd like it if you quarantine before you leave as well. I think that's going to keep all of our people safe and keep their families safe when they get home.
There's a lot of different factors here. For example, kids who come home are told to isolate for 2 weeks. Can we be honest? Is that really possible for all families and all kids coming home from college over Thanksgiving or going back to college? Either there isn't the space for it or the mindset for it. I haven't seen anybody do it.
Okay, I was 18, I know. But look, that's why we're saying at least the testing is so important. That's why you test before you take off. If you're in an airplane, want to show that you've tested negative. Most people come back by driving, by the way, so it's a little bit of good faith. And also when you get back here, we want you to get tested as well. I'm not going to dismiss quarantining. It's so important because you can be infectious for 14 days.
Here's the bottom line with that, though. Can we be honest? Testing. You can test negative and actually end up having coronavirus, but it doesn't show up in the test. There are false negatives, false positive. Also, it's too early in the virus. Testing is as sketchy as quarantining. It almost seems like the only thing that is possibly helpful on a uniform level is uniform mask wearing.
Well, don't let the perfect be the enemy of the good. I mean, testing, especially true testing, makes a big difference before you leave, after you get here. But you're absolutely right. There's nothing more important than mask wearing. I got to say, I'm very thankful for the people of Connecticut. They showed me one of those heat maps the other day, and it was very red over Connecticut. And I said I thought we were doing better. But then it indicated that we were more likely to wear the mask than just about any other state. And I think that served us well. But right now, we see the storm clouds coming again.
As long as there are those that simply refuse to wear their masks, the situation will only continue to get worse. just over 11 million cases nationwide have been reported and over 247,000 deaths and climbing. So sometime between now and January 20th or shortly after the 20th, if things don't turn around, I am personally predicting a national stay-at-home mandate from the Biden administration. It's the only thing that makes sense. Now, on a more positive front, there's some promising news about a vaccine that could be ready as soon as next month.
Another potential breakthrough, a second vaccine showing success against COVID. Moderna says its vaccine has been found to be nearly 95% effective in early results.
We now have real data in large phase 3 trials showing that they are safe and effective at preventing COVID-19.
And the results showed the vaccine also might prevent severe disease. It comes just a week after Pfizer announced preliminary results showing its vaccine was also found to be more than 90% effective.
So now we have two vaccines that are really quite effective. So I think this is a really strong step forward to where we want to be about getting control of this outbreak.
Both vaccines require 2 doses and use groundbreaking technology, messenger RNA that gives your body instructions to produce a portion of the virus, its critical spike protein that triggers an immune response, creating antibodies to fight off the virus. And unlike the Pfizer vaccine, which must be kept at 94 degrees below zero and shipped in special freezers, Moderna's can be shipped and stored for 6 months in standard freezers and stored for 30 days in a refrigerator.
It doesn't require dry ice or the types of ultra cool distribution that have been reported with the Pfizer vaccine.
If both companies get emergency authorization, 20 million Americans could start getting the vaccines as soon as December. 10 million people will get Moderna's and about 10 million more are expected to get Pfizer's, starting with those on the front lines, healthcare workers and first responders, followed by essential workers like teachers, law enforcement, and food plant workers, as well as adults over 65 or with high-risk conditions. The rest of Americans would get access to the vaccine at the end of March at the earliest.
The side effects are what you would expect to see with any vaccine: sore arm, fever, fatigue, muscle and joint aches for a day or two. And with Moderna's vaccine not needing to be kept at such extreme temperatures, experts say it will make getting it to rural areas much easier.
So even as the news looks good for an effective vaccine, there are still some Americans who are hesitant about taking
With
it.
vaccine authorization expected soon, the biggest challenge moving forward may be injecting Americans with enough confidence to take the shots.
We get vaccines to the American people and they don't take them. Shame on us. Hey, I was already sick. I don't need it. Shame on us.
Many are wary of the vaccine's unprecedented speed. Others are polarized by politics. With the election now over, a recent Gallup poll found that even after nearly 250,000 Americans have died and many more have endured restrictions and shutdowns, 50% of the country still does not want to take the vaccine when it becomes available. That includes Irina Barlage, a physical trainer in Los Angeles.
I personally decided I'm definitely not going to take it.
No matter what, you're not going to take it.
No matter what. I believe I'm a healthy, strong person. It's relatively new. I'm in general a little skeptical about what I want to put in my body.
Barlage is not alone. She says most of her colleagues and clients feel the same way.
We honestly have a vaccine confidence problem in this country. We have huge parts of this population that just do not trust the manufacturers of vaccines. Even in a good year for the flu vaccine, we only see about half the population getting it. And the flu vaccine is a really well-studied vaccine that we know is incredibly safe.
The fear of the vaccine comes with the reality of rising COVID numbers. Cases are jumping across the country, including in Los Angeles County.
And much of the nation has been experiencing a significant increase in cases and hospitalizations.
Dr. Jeffrey Gunzenhauser, LA County's chief medical officer, says an effective vaccine could be the cornerstone to reopening many shuttered businesses.
Would you be willing to take the vaccine?
I would say I will do what I hope everyone does, and that is I will look at the information that's made available, and if it looks to me like it's safe and effective, I certainly would be glad to step up and get the vaccine and show people as an example, hey, I'm getting the vaccine. but it is an emergency use authorization. It's not a fully approved biologic. So there is really that need for each individual to be fully informed about what it's for, the benefits, the cons, what's unknown about it, and realize they have a choice whether to do it.
With COVID numbers spiking, the vaccine could be available to some as early as December. Medical professionals tell ABC News the vaccines appear to be safe and effective.
Indications that we've seen is that the companies have been incredibly vigilant about maintaining sort of, the integrity of the process of clinical trials when it comes to vaccine. There's no signs of any cutting of corners. We have not seen anyone cutting corners. In fact, we've seen the opposite, where companies who have identified adverse events have paused trials to investigate. My plan is to take the vaccine when it's available to me. I work at a healthcare organization, so that they will decide when it's time for employees of our hospital to get the vaccine. And yes,
Dr. Anthony Fauci is making it clear that once the drug makers get approved by the FDA, he's on board.
If they look at this data and they say this data is solid, let's go ahead and approve it. I promise you, I will take the vaccine, and I will recommend that my family take the vaccine.
As the country waits for answers, individual states are now scrambling to prepare for the vaccine's rollout, some stocking up on ultra-cold freezers for storage.
As the country waits for the vaccine, cases have jumped here in Los Angeles County. They've been forced to extend the hours for testing here at Dodger Stadium. And here in Los Angeles, more than 32,000 people are being tested every single day, a number that continues to go up.
And as testing continues, one of the biggest problems that Pfizer and other pharmaceutical companies have had is in recruiting black and brown people as volunteers, and not without good reason.
Today marks a major milestone in the nation's fight against COVID-19.
In Savannah, Georgia, Dawn Baker not only anchors the news, she made huge headlines herself last month. She was the first volunteer as part of a phase 3 clinical trial in the U.S. to get injected with a potential COVID-19 vaccine, the final step before a drug can be approved.
You've had 2 doses.
Yes, yesterday, Monday was my second dose.
How are you feeling?
I feel great. I had the
no side effects.
My arm was sore, similar to when you get a flu shot.
Her private doctor for 30 years, who's involved in the study of a drug produced by Moderna, asked her to do it.
Had to make sure that it wasn't a live virus and that there was no way that I could get COVID-19 from being a part of the study.
After seeing so much suffering due to COVID, especially in the African-American community, Baker stepped up.
I've had friends who've lost very close relatives, people that I know. I've also had some friends who have passed as well from COVID-19. So it kind of made sense to me that, instead of just being afraid, how was I going to be a part of the solution?
She's gotten a lot of praise and more on social media.
And as you told me, some people think you're absolutely crazy.
Of course they do. I mean,
what's your response to that?
Well, I really have decided that, being an on-air person, I learned a long time ago that you really can't read comments because there are going to be just as many people who love you as hate you. One comment was, this sister isn't woke because she's worked for white people too long. She doesn't know they'll try to kill us.
Sounds extreme, but it's an example of the deep mistrust of the medical establishment that exists in the African American and other minority communities. And the reason researchers say they're having trouble finding enough minority participants in the COVID vaccine studies. So far, of some 360,000 online volunteers for vaccine trials, only 40,000 are minorities, much lower than their share of the overall population.
We want them represented in vaccine trials so that we can ensure that the vaccine works well in these populations, since they're most at risk.
What do you say to people who are mistrustful of this process and the medical establishment generally, and the government for that matter?
Yeah, I first start by saying I understand. I get it.
Dr. Stefan Wallace leads the effort to involve a diverse array of volunteers in the trials, especially from minority communities where the pandemic has hit disproportionately hard.
I think that the medical establishment has a lot of work to do to build relationships and build trust and to make amends for a lot of the issues that have occurred in communities over the years.
Wallace and other experts say perhaps no issue hangs heavier than the Tuskegee syphilis study. Beginning in the 1930s, some 600 men involved in a U.S. government study of how the then rampant disease developed if left untreated.
What was so terrible about that was, first of all, they were not told that they were being studied.
Lily Tyson Head's father, Freddie Tyson, back then was a sharecropper, devoted father of 8, and once a fireman at the airfield where the famed Tuskegee Airmen trained.
And they were not told that they had syphilis. And then when penicillin came out, they were not allowed to get the penicillin for treatment or cure.
No one knew the truth for some 40 years.
The Associated Press reported today the Public Health Service conducted a 40-year experiment on 600 people with syphilis and purposely denied treatment to 200 of them to see what effect this would have on the human body.
The U.S. government settled a lawsuit. Decades after that, President Clinton apologized.
What the United States government did was shameful, and I am sorry.
How much of your grandfather's experience is what's motivating you now?
So my grandfather and I were really, quite close. He helped raise me.
Granddaughter Carmen Thornton is a public health expert. Tyson's family hopes part of the men's legacy will be greater involvement by people of color in the medical community. They're encouraging volunteers to get involved in the clinical trials and every aspect of the effort to fight COVID-19.
What would you say to these researchers, drug companies, others who are trying to recruit people of color into these studies?
Nothing about us without us. There has to be involvement in very strategic planned approaches that include minority population and representation around that table when the plans are starting.
With several more phase 3 clinical trials about to get underway in the U.S. and tens of thousands of volunteers needed as soon as possible, drug makers and researchers say they're stepping up outreach, especially in Black and Latinx communities.
What do you think is at stake now for the Black community?
Well, it really is a matter of life or death. I hope that people would really consider it, because really we have to get something done. And all the experts say there really is no way out of what's happening now unless there is some kind of vaccine.
As of this recording, Pfizer is filing for an emergency release of their vaccine so that they can get it to first responders even sooner. We'll have to watch and see what happens on that front. Coming up, there's an aspect of the coronavirus that doesn't get talked about a whole lot, but it needs to be. More right after this. If you're an advertiser, one of the most important things about getting your message out is actually standing out from the rest of the crowd. If you're listening to this program right now, this is where you'd hear your commercial. As an exclusive sponsor of Gunshots Straight from the Hip, your commercial is professionally produced and gets a longer shelf life based on your needs. Gunshots Straight from the Hip is a unique and compelling program unlike anything else in the marketplace. Episodes are available for download on iTunes, TuneIn, and MarkGunMedia.com. And depending on how you tailor your message, the potential for new and repeat customers is that much greater. Best of all, it's extremely cost-effective. If you'd like more information on how you can be a sponsor of this broadcast, call Mark Gun Media Inc. at 502-407-0283. That's 502-407-0283. Or log on to markgunmedia.com. For downloads of this and past episodes and information about all the multimedia services we offer, log on to our website at www.markgunmedia.com. That's markgunmedia.com. Welcome back to Gunshots Straight from the Hip. I'm Mark Gunn. Remember, you can subscribe and download past episodes on iTunes, Spotify, Google Podcast, or our YouTube channel, or wherever you get your podcasts. This episode, we're giving you an update as to where America stands on the coronavirus, especially important since we're heading into Thanksgiving and the holiday season. Before the break, I mentioned that there was an aspect of COVID-19 that doesn't get talked about a whole lot. It affects those that are on the front lines of the pandemic. Doctors, nurses, and paramedics like Dan Flynn of New Orleans.
We got pretty rough news. One of the nurses here in New Orleans that was positive for the coronavirus ended up losing her battle with it today. I guess when you think about it, it's just sad on top of all the stress of it, and managing, the where to put patients and how to take care of them and the ventilator topic and all these things that go on. And then you hear, about, the death of a colleague of a nurse in your city, that so many people that knows, and it's tough.
What he describes is just the tip of the iceberg as it relates to what these men and women go through on a daily basis, and we take them for granted. I thought it would be a good idea for you to hear directly from some of these doctors and nurses because they can tell their stories much better than I ever could.
I do believe very much in resilience when humans really facing extreme adversities. However, I think that the mental stress of this outbreak is something that we have not seen before. And this is something that we frankly are not prepared to deal with. My name is Yuval Neria, and I am a director of the PTSD program at the New York State Psychiatric Institute. We will see PTSD, high levels of anxiety that are not really diminished over time. But what you see lately, you see more of a depressive symptoms. There is fatigue. We're already hearing about suicide attempts and successful suicide attempts.
On Sunday, April 20th, Dr. Lorna Breen, an emergency room doctor at New York Presbyterian Hospital, committed suicide.
She even contracted COVID herself. As soon as she was better, she went back to work.
And the extensive media coverage of this tragic event reminded us all of the mental health challenges that our frontline medical workers are facing.
I'm crying at work. You come home, I'm crying in the shower. I wake up, I got to go back to work. I'm crying, pouring my coffees. My name is Daisy Filzer. I am a nurse in the medical ICU unit in a hospital here in the Chicagoland area.
I know people think of hospitals as places where people are very sick, but people don't actually die that often. Honestly, maybe be 3 or 4 a week. And that went up to like 20 to 30 per day.
The amount of COVID patients that have come in has definitely decreased. But when it was at its height, people would come in continuously through the day, and it was nonstop. It was a daily nightmare. Those first few days when things were absolutely chaotic, I would come home and I literally didn't know how to transition. It was like war.
We're starting to see those on the front lines of healthcare having some mental health outcomes. I'm Dr. Shauna Springer. I'm known within the military and veteran community as Doc Springer. PTSD is a prolonged shift in your assumptions based on being exposed to something that leaves you with a feeling of helplessness or horror and changes how your biology functions and, basically how you operate in relationships. And many of our ER docs and nurses are wired like some of our combat warfighters in the sense that they can stay calm in a chaotic situation because of their level of training, their skill. And if you send them into a situation that increases their sense of helplessness and maintains that sense of helplessness, it will have the kind of mental anguish effect that we are seeing among those in the front lines.
Yes, death is a part of our job. However, after so many patients dying and after so many, days in a row, it's kind of like it takes a toll on you. And it just kind of hit me and I just became overwhelmed and I just started to cry at work. And my coworkers are like, what happened? What's going on? I'm like, nothing happened. It's just you don't really have time to debrief after everything that's going on.
Those were the days when I would FaceTime my friends and they would ask me how I'm doing, that I would just start crying because you don't think about it in the moment. You don't think about the fact that you just saw this old woman who has had a beautiful, vibrant life, lots of children, lots of grandchildren who just died in front of you and you didn't have time to call their family. And there's no one there to call the family.
We're also socialized to treat people as though they're heroes when they're on the front lines.
Whenever people are calling me like, oh, you're a real hero, it makes me feel uncomfortable. I don't know why. One, maybe because I'm not one to really accept compliments. It's one thing to tell me that I really appreciate what you're doing, but I feel like heroes don't work in these conditions where they aren't optimal to do their job.
The imagery of heroism lends itself to like going and taking care of the patients and not thinking about yourself.
We wake up, we go to work, we save lives. That's just what we do. And I'm honored by the hero title. I have texts from a bunch of people from my past who have creeped up, like, thank you so much for your service. I'm thinking of you. And those things just bring me to tears with joy. It's like the most insane feeling in the world. And the 7 o'clock claps, I mean, it gives me chills every single day to hear this. When I'm going into night shift, I literally walk through it and I hear people clapping for me to go to work, which is insane. Like celebrities hear that, like basketball, like athletes, right. That. And it feels really great, but I don't necessarily feel like a hero any more than any other day.
Now, there are some simple ways that you can show your support for these heroic doctors and nurses. The easiest is to join an initiative called Light It Up Green. It actually started back in May as a way to remove the stigma from mental health issues. If you've driven around your city, you may have seen homes with green porch lights. Those are folks that are showing their support for these first responders. My wife and I and several of our neighbors have gone green as well, and as the virus continues to run out of control, they're going to need our support even more. Now, you can continue to do your part first and foremost by wearing a mask no matter what. The majority of businesses are now requiring them, so there's really no excuse. Continue to social distance, wash your hands, and use sanitizer whenever possible. Most importantly, get tested. If you already have, get tested again. There are a lot of false negatives being indicated, and speaking from personal experience, I had the absolute worst case of the flu I've ever had. Took me out for 3 weeks. My COVID test came back negative, but in hindsight, I'm really not so sure that I didn't have the virus to begin with. Bottom line is that the only way we've got a chance to beat this thing is if everybody is on the same page. So as you get with your families this holiday season, please keep that in mind, okay? Take care of yourselves and stay safe. You've been listening to Gunshots Straight from the Hip. The views expressed are those of the host and guests and not reflective of any business entity or anyone associated with this broadcast. If you have any comments or want more information on how to be a sponsor, log on to our website at markgunmedia.com or call us at 502-407-0283. That's 502-407-0283. Thank you for listening.
Mark Gunn Media. No hype, no hoopla, just damn good work.